A closer look at Central Oregon Community College. I'm Dave Adams. Now that voters have approved a $41.5 million construction bond, the green light is given to build a new health sciences building at Cocc. Mary Jane Kuhart is instructional dean and tells us that healthcare today is in big demand.
Well, those are areas right now where we've seen quite a large increase in student enrollments. And we have some existing healthcare programs, such as dental assisting, massage therapy, medical assisting, nursing, and also CNA type of nursing program. So we're hoping to be able to expand our capacity to some degree in all of those areas. We also are planning to begin a pharmacy technician program. We'll have our first group of students entering that cohort this winter. We still have some other programs that are under consideration, including some things like occupational therapy assistant, mental health technician, and possibly veterinary technician.
With more room, what does that allow you to do specifically? Have more medical labs?
Exactly. Not only will we have larger lab spaces to allow the students to have a better hands-on experience, as you mentioned, but we also will be able to really update our equipment. Our current facilities, many of them are 10 or more years old for the healthcare professions, and in the science areas, they're some of them 20-plus years old. So it will be really good not only to have expanded facilities, but updated state-of-the-art facilities as well.
When is this building going to be constructed? Any idea?
Well, we're quite far along in our planning process for our healthcare programs, the ones that I mentioned. And so we hope to begin construction on the health career building sometime in summer of 2010. The science building, that planning process is probably going to take a little bit longer. And the thing about these types of buildings are they're really the most complex building that the college will ever build. And we know that. We've done some work with some other community colleges, with some architectural firms. We've attended some national conferences. And pretty much the message is that you really need to be thoughtful in your planning, because you're not only planning for what you're going to need in the next 5 years, you're really planning out for the next 20 years. And so that we have to build the flexibility in to have that space not only meet our current needs, but meet needs that we'll have in the future.
Are we going to find dental labs and other medical facilities in there?
Well, you are going to find a dental assisting lab, and the thing that's really cool about that is we will actually have dental chairs, and that area will not only serve as a lab for our dental assisting students to learn how to perform those skills, but we have a partnership with the Volunteers in Medicine, and we have a dentist who comes to campus about once a month, and we do provide some dental services for low-income patients in our community. So we will, in fact, have a dental clinic. We'll also have a massage therapy clinic. Our massage therapy students offer the ability for massages to clients in our community. So we'll have that as a client area as well. And then the pharmacy tech will be a space that will essentially replicate an inpatient and outpatient pharmacy areas. So students will be able to learn how to do skills associated with hospital work as well as with retail pharmacy work.
So pharmacy is a new program. When is the pharmacy program going to be added?
We're going to accept our first group of students this winter.
Okay, before the building is constructed, but then they'll grow into it.
Exactly. Yeah, we're doing quite a number of the courses in an online format, and the students will need to come to campus for some of their laboratory skills. And what we're probably going to do until we have our new building is do that either on the evenings or in a weekend intense format, so that we're not running into the already scheduled classes in some of our lab spaces.
Do you expect this is even going to bring more students? Now, you've had some explosive growth already in the last several years at Central Oregon Community College. Now that you actually have a facility, do you expect to bring in even more students?
Well, we hope so. We have a pretty ambitious long-range plan to try to expand our program. So, for example, our dental assisting program right now is about 24 students. We're hoping to be able to expand that perhaps as up to 32. Our medical assisting program right now is about 32 students, and we may be able to increase that maybe up to 40. We are in the process currently of expanding our nursing program, and certainly without this new building we wouldn't have been able to continue doing that, but we're hoping eventually to almost double the size of our nursing program, both RN program and our CNA program.
Mary Jane Kuhart is an instructional dean at Central Oregon Community College. I'm Dave Adams. Take 5 is a production of 1110 Kbnd Radio News. Depend on us.